Hello, everyone. Welcome to the Ophthalmology Business Podcast. We help you develop your ideal practice with help of other doctors and experts. The topics we cover include marketing, management, leadership, recruitment, HR, mindsets, and more. I'm Guido Paquette, one of the co-hosts of this podcast. Every listener of this podcast is welcome to join the Ophthalmology Business Academy at www.obacademy.org. The membership is on us, and it's our gift to you. Today, I'm excited to talk to Brian Stone, the co-founder and chief strategy officer at Clearwave, about patient engagement trends. Let's jump in. How's it going, Brian?
Doing great. How are you today?
Doing pretty good, other than the freeze in our backyard in the Austin area, having to close clinics, but it's what we deal with on a daily basis, but doing pretty good. So thanks again for joining me on this podcast. This is a journey that lets us talk to experts in the field like yourself. And we're excited to kind of jump into today's topic, which is patient engagement trends. Thank you so much for joining me again. And let's get started. Can you just introduce yourself to the podcast listeners and just talk a little bit about your experience and kind of how you're connected to ophthalmology?
Sure. So I'm a healthcare entrepreneur, serial entrepreneur. You know, I've founded two radiology companies back in the late 80s and 90s. Started an HIE company early 2000 and has started an AI company and joined Clearwave and started Clearwave in 2004. And Clearwave is a patient engagement platform with really our two largest specialties. We've integrated and worked with just about every different specialty, but our two largest is ophthalmology and orthopedics. So we have a lot of experience in working with those two, those two specific specialties.
Yeah, so you understand the challenges that ophthalmology practices face on a daily basis, and anything we can do to make that experience a little better for everyone is a good thing.
Yeah.
So patient engagement. Let's talk about today's topic. So it's a buzzword, but what does it mean? Can you break down for us, what does patient engagement mean to you?
Yeah, I think to keep looking at it very simply, I think patient engagement is really a platform is trying to simplify the patient interaction with a very complicated healthcare system. And the analogy I use is if you think of Apple and what they've done with, say, an iPhone. Right. So, that is a platform. You can see that as kind of a consumer engagement platform, right? They provide a means so you can download music and create your own playlist. You can download an app to pay, to order and pay for Starbucks. You can download an app that allows you to put in a map and be able to. So a patient engagement platform is simplifying that process for a patient, and the components of it are typically some way of doing self-scheduling, right? So how do you provide a way for a patient to self-schedule? How do you provide a patient to pre-register? How do you provide a platform that allows a patient to digitally check in? And then how do you provide a platform that allows a patient to essentially interact with the practice in a means other than picking up a phone and calling it?
Right. And I'm going to give you a perspective from a patient for a second. So I just a few hours ago went and saw a physician for some issues I'm having with my back. And so when I got in, they handed me a clipboard, and the paperwork was literally, I'm not kidding, about 35 pages of paperwork. And on every single page, it had name, date of birth, phone number. There was so much replication on every form. And as I'm sitting here looking at this form, I'm thinking, I'm going to talk to Brian today and tell him about this form, because it was just so annoying from a patient perspective to be handed this book to write before I'm going to see the doctor.
Yeah.
So how do you think then, obviously we'll talk a little bit more about how this benefits the patient, but how does focusing on improving your patient engagement tools or just or just investing in it altogether, how does that benefit the practice?
Yeah. So if you can get the patient to essentially digitally and begin to use technology versus what you just described, instead of having you write your name, which is frustrating to you, right? That's a benefit to the patient, is the fact that if you could digitize that and not have every single form have your name and have it know that, okay, here's your name, have your name pre-populated on this form. So if you use the digital technology, then from a practice perspective, the benefit you get is now, instead of having paper that you are having staff scan to put back into your EHR, you now have discrete data that can begin and have those forms digitized and go into the system automatically. You have the system able to validate the patient's insurance real time, have the system begin to collect the copays. So the more you can get the patient, if you have a patient self-schedule, then what happens? Well, then that patient's not picking up the phone and occupying your call center to essentially. So every touch point that you can digitize and have the patient engage and do it themselves has downstream time savings and cost savings in the practice.
Right. And probably better information. I know from our personal experience, before we digitize our forms, the patients would fill out some form of paperwork. I can't tell you how many times that we would look on forms, there was information we're looking for, and the staff just either missed it or just didn't grab that information from the paper form. So there's different processes that humans are fallible. We make mistakes. It's tough. There's a lot of stuff happening in the practice. So I think the practice can benefit by getting better information that you actually want. Like that book that I just filled out, I'm sure that nobody even looked at it, or, it's like, why did I do it? No one looked at it.
Yep. And you bring up a good point, because I mean, even with software, unlike humans, whatever you program it to do, it's going to do, right? So that if a patient is using a digital process, they're going to be asked to fill out that information. So our clients tell us that, prior to essentially, deploying a patient engagement platform, they didn't get the email address, an updated telephone number. Afterwards, they're now saying we now have 2 times, 3 times, 4 times more correct phone numbers, correct email address, all the stuff that you just said. That if you put on a piece of paper, you're not sure that data is going to ultimately get back into your practice management system.
Right. And so let's talk about the patient now. I very emotionally described to you the benefit that I would have seen for my visit today. But what other benefits other than being annoyed do you see for the patient when a practice invests in its patient engagement platform?
Yeah, I mean, you described an obvious one. You also, if you're allowing a patient to self-schedule at home, I put myself, my wife was referred to a retina specialist, and so her ophthalmologist gave 2 names. Well, I came home, I'm busy. I work during the day at 7:30 at night. I'm looking for those 2. I'm looking at both those doctors. Well, neither one of them had the ability for me to schedule that appointment at 7:30 at night. That's when I want to do it, right? That's when it's convenient for me. Versus calling up at 12, noontime. I have a break noon, and then what do I find out? Oh, well, the office is closed until 1. Now I call back at 1:30 and I'm put on hold. So from a patient experience perspective, each one of by allowing the patient, for example, if you were able to complete all that paperwork at home, not have to double enter all the information, your experience, number one, the process would have been quicker when you got to the office, right? So if you were able to do that an hour before your visit, now all of a sudden when you showed up, you wouldn't have to show up for 20 minutes in advance of your visit. You'd be able to show up 5 minutes and go right back to the clinical area.
So my appointment was at 1:30. I came in at 1 o'clock to fill out the paperwork, and they called me back at 2:15.
Yep.
So I wouldn't say that was very efficient.
Yep.
But I think you'd be surprised, though, if some of the people listening to this podcast might think that that's a normal process for a practice, but I can tell you that patients are looking for more, need from a patient experience, and then our experience dealing with our patients. The expectations have changed.
Yeah.
We have very busy lives, and that's not new. But what is new is the focus on the ability to do better, especially after the COVID pandemic, where these tools came to the forefront and practices were forced to do these things. And now I see it as more of an expectation from patients as opposed to an option. So I think if you don't have it and patient visit your practice, they think that you're behind. Right?
Yeah.
I recently did a podcast with Sean Hanlon about the patient payment experience. From a payment perspective, you mentioned a little bit, but how do patient engagement tools improve the payment experience? Because as we talked about during that episode, the payment experience is very important because you can have a great overall experience, but if that payment experience is soured for some reason, then you can have an overall negative view of the practice. So how does that help? How does patient engagement help?
And it goes back to examples that we've talked about in your day-to-day life. You're seeing more and more opportunities, and online stores, even governments, allowing you to make your tax payment via a link versus cutting a check. So if you look at the number of checks that are written from 10 years ago to today, less and less, and it's more convenient. Anytime I get a bill, the first thing I look for is, can I go online to make the payment? And if I have that opportunity, I'm more likely to pay it more quickly versus, okay, now I have to go find my checkbook. Now I have to fill out an envelope, So from a convenience perspective, by providing tools to allow the patient to make payments without having to, both when you're billing and sending out invoices, allowing them to link into that or sending text messages. When from a patient, from the point of registration, I can't tell you how many times, and I'm sure the audience has examples of this as well, how many times in the last 5 years I've gone into a provider's office, know that I owe a copay, go up to the front desk, I'm not asked for the copay, and then when I say, oh, I owe $20, I want to pay you today, and the staff will say, we'll send you a bill. So when you create a patient engagement platform that essentially makes it easy for the patient to essentially make that payment, maybe they have a card on file, but make that payment, ask for the payment and make the payment, you increase the point of service, you increase the number of payments that are made. And in my opinion, if something as simple as a copay, if a copay is not collected at the point of service and you have to send a bill out, the cost of sending a bill out offsets the cost of the copay. And you probably know better than I do, but it's like, so the most efficient way of the digital platform and patient engagement platform, a good one, will ask for the payment, provide an easy way to make the payment. And you'll see, we have clients that have 150% increase in point of service collections just as a result of having a good patient engagement process. And
I'm glad you said that, because another part of that, when it comes to the payment experience, I think is obviously the eligibility information.
Yep.
So if the platform that you're using has a good eligibility tool to help pull that, because I bet you in that case that you mentioned, which I also see many times, is where they say, well, we'll bill you, because they're not sure what the patient's out-of-pocket responsibility is. And that sometimes that people will, they'll have to have teams of people to be able to do eligibility and to put that information in the patient's record, so that by the time the patient comes in, that we know what to collect for this patient. So that tool, if we can get the information ahead of time, the system starts to verify that patient's insurance eligibility, and then we can use it as a tool to be prepared and not to have all these resources is another part of that, because as patients, the expectation is that us as a practice have all the answers regarding every single person's insurance, not realizing that from a patient perspective, really, it is a patient's responsibility to understand their coverage, but that's not the reality in the patient's mind. In the patient's mind, they're coming to our practice. We should tell them exactly what they owe, So we have thousands of patients coming into our practice every day, and we're supposed to have the magic answer for every single patient, and it's not possible, but we can get closer with a really good tool and a good patient engagement tool.
Great point.
So let me ask you about patient engagement tools in terms of the patients that are likely to be more successful. And let me explain. So before we implemented patient engagement tool in our practice, the mindset was, well, we have an older population base. They're going to really have a problem with it. So can you speak a little bit about if a practice is considering patient engagement, about their patient demographics and some of those things that may hold them back from doing so?
Yeah. And what's interesting is, the company was founded in 2004, so we've been doing this for 18 years. And one of the points I make is a 75-year-old in 2004 is very different than a 75-year-old today. Okay, I think the iPhone was introduced 2005, 2006 timeframe. So I have a brother-in-law and sister-in-law, 72, 73 years old, and they are on iPhone, they're on Facebook, they're technology savvy. So I think the first thing is, that 65-year-old, that 70-year-old is very different in 2023 than it was in 2003. Number one. Number two, the other important thing is to provide multiple form factors. So some 70-year-olds will use their phone and are comfortable with their phone. But in an ophthalmology practice or a retina specialist, well, patients are coming in with eye issues, right? So having a kiosk with a 15-inch screen and big print is something that is an option, and they may prefer going through that process versus using their phone or using a tablet. So what we see is, if you provide the patient multiple choices of the ways that they can actually digitally check in when they come into your practice, you'll see very high utilization. We see 85-90% utilization. Average age that we see in our ophthalmology practices, you're talking about average age of 65, it's that 60, 62, 65. And we're seeing that high because we're providing the patients the options to either use the big screen, use the phone, or if they want to sit down and use the tablet.
And you took the next question kind of out of my mouth regarding, the way that a person is going to interface with a patient engagement tool. I have a very strong opinion about you can really go too far. You can not do it at all, which is the mistake that some practices make, or you can go too far in thinking that it's going to be this great thing and we're going to throw all these tons of questions on this patient, because you can have that same annoyance factor when you put a patient engagement tool in your practice if you don't do it the right way.
Correct.
Because let's use an example of the airport. Okay, it's pretty simple, but when you see people standing in front of those kiosks, there is a stress factor. There is sometimes their thought processes, don't click, and sometimes it honestly, it amazes me how many people have a hard time at the kiosk, and I think that's a factor that we have to consider when we select a tool, which is the word simple. You said the word simple. So can you speak to kind of, since you're working with Clearwave and you're working on what's more likely to be successful, how can we simplify that engagement tool to make it actually something that's useful for the patient?
That's a great point. And I think that first thing is you need to really be stressing to the patient to do the pre-registration. That shouldn't be a nice to have or an option. It should be, you have an appointment, you just schedule the appointment. We go through your example. You schedule the appointment, you're coming in at 3:00, and here are the forms that we need you to fill out before you show up. And by doing that, you're giving the patient the ability to sit down and actually complete the forms in the comfort of their home. with the technology they want. So when they show up, the check-in process, you're reducing the amount of, you're reducing the 15 pages or 15 screens down to 2 or 3. So the more you can get the patient to do at home, the better. Number two, also having a platform that remembers what is required, what you have done, and also only requires you to do what you need to do for the type of appointment, the doctor you're seeing, the appointment type. So don't have every patient answer every single question, right? If you're coming in for a specific type of appointment, only have the questions related, have a system that's smart enough to, instead of presenting every patient 25 pages, this patient may get 10, this patient may get 12, this patient may get 2, based upon what you know about the patient, either what they've done previously or the appointment type. So having a system that's smart. So again, like you said, keep it simple for the patient and only require the patient to actually complete what's relevant for their appointment type.
That's 100% true, because I just experienced that when we switched our EMR systems, our patient engagement system had to kind of do a little bit of a reset. So some of the patients coming in had to fill out the form that they felt that they filled out. So we heard it, right? So you have to really take that in consideration when you're setting up your patient engagement platform. It has to be logical. Like, there cannot be repetition. It has to be smart enough that it's going to be a benefit and not just another annoyance for the patient. And be careful. This is my personal piece of advice. When you're setting up a platform, be careful about the level of complexity versus the level of information that you want to get out of it, and use a platform. And your 2 questions ago, you said the simple interface. I think that's huge too. Make sure that there's not too much to read on the screen, because the patient's level of patience starts to wane the longer they stand at that either kiosk or the digital platform that they're getting that questionnaire from. So I think that's a great point. What about practices that are just saying, no, I'm not going to do it, it's not going to bring any value? What are some of the reasons why you think practices don't want to make that investment to get a patient engagement platform?
I think what I've seen over the years, providers, doctors have been sold a lot of things that are promised, a lot of returns, and they don't deliver the returns. So the first thing is really, convincing the practice that that investing in here, you're going to get the returns that we talked about. Point of service collections increase, FTE savings, and things like that. I think that the second piece is that practices don't, we've been doing the same thing, and practices have been doing it the same way for 15 to 20 years. So really the change management, really convincing them and helping them transition from a habit, a 15-year habit, to truly trusting a digital process. That's a big transition. And I can share stories with you where we typically say, it's a good 90 day. It's a good 90 days, from three months to 6 months, had a practice that this was a administrator that had deployed our technology at one location, went to a new practice. So he's done it already. And about 6 weeks into the implementation, he called me, he goes, Brian, the staff is kind of getting stressed out. The patients are still complaining. They're really pushing back. And I said, just hang tight. You're going through the change. You have to hear and I connected him with colleagues like yourself and peers. And he spoke to him. He got some suggestions and making sure that, everyone's on board. The doctors the doctors know what the talk track is, right? Because if a patient, the first time they're using technology is a change, people don't like change. But once they realize that change makes it easier for them, then they don't want to get rid of it. So what happened was this, so 6 weeks he's having struggles. About 5 weeks later, I get a call from him, and he goes, Brian, I came in on Monday morning. He goes, it was like the storm had lifted, the clouds had lifted, and he goes, all of a sudden, it was like the patients weren't complaining. My staff loved it. And 3 months later, they had an issue with one of the kiosks went down. He calls up and goes, my staff can't live without this. So they made that, so they got through that transition and that change management.
Yes, 100%. Change out of anything. And even when we talked about the EMR switch and we talk about implementing new tools, that's the biggest thing. Change is hard. You have to have a plan for change. You have to have a plan for having stakeholders to push and promote change. Change is hard for your patients. And so considering the right tool is key. I'll tell you another quick experience I had and another, just a regular annual physical. A big hospital system had switched to a patient engagement system. And so as I'm standing in line, I'm witnessing older patients, probably in their 60s and 70s. I say older than me. I'm not saying they're old. But so the lady said, okay, we've switched to digital paperwork. Now, can you take your phone and can you take a picture of this QR code so you can fill it on your phone? And I just watched this interaction, and it was just, I was like watching a car wreck. And she's like, what? Can you help me, honey? And she's taking her phone, and she says, let me do it for you. She grabs her phone, she takes it, and then she's holding her phone. I'm standing in line behind in the front desk, and she's holding her phone, and she's asking the patient the questions and filling them out on the patient's phone. And it took 20 minutes before I got to the front. And when I got to the front, I scanned the QR code, I sat down, I looked at it, and the tool on the browser where that information and questionnaires, you couldn't read the consents. Like, they were so small, you had to zoom and pinch and you couldn't see them. And so the point of that story is choosing the right patient engagement tool that's going to make it a good experience for the patients and also for the staff is key.
Yeah.
So let me ask you about kind of the future. So you guys are always looking for what's next and you're on the cutting edge. So what's coming, or what's something that you see coming? Maybe not something that you've developed, but something that in a pipe dream, and can we walk in and the system knows our thoughts and starts to just figure out what we want, or what's something cool that's coming?
Yeah, I think as we looked at different technologies we could use. I mean, ideally, we would love to see a day where the example you just used, see a day where when a patient walks through the front door, we recognize that they're there and they don't have to go scan anything. Their phone just pops up and they can start the process without scanning a QR code or without going to the front desk and having someone send a link to start the process. I think, two trends that we're seeing. It's not really technology trends, but there's two things that we're seeing that are important in really a successful patient engagement platform. On the one end of the spectrum is the patient acquisition strategy. The patient engagement platform that has self-scheduling is great, okay, but if the practice doesn't have their website to a point where they're optimizing Google searches and that they are making sure that when the patient is doing the search, right, in order to use self-scheduling, you get to get the patient to that link. So there's a whole piece that we're seeing a lot of practices not pay attention to. We have clients that we've deployed, and it's like you got to go through 7 pages before you can find the link to self-schedule. So you have to, so I think there's a whole patient acquisition and technologies around optimizing searches and making sure that the practice is on the top in the doctor's name, and you can get to you can get the patient to your website, and once the patient's there, making sure that it's easy, back to simple. They're going to be able to see when they come there, they should be able to either go right to the link to start the process of self-scheduling or see a button that allows them to do it. So I think that's one in the spectrum. The other thing we're seeing on the payment side in the back end is the No Surprises Act has created a requirement for practices to do estimations, to essentially provide an estimation for certain services. So it's a requirement, and there a lot of practices are deploying technology. We're seeing practices not just do it to now comply with a law, but they're now taking the patient estimate and beginning to collect on it. So historically, over the last 18 years, we've seen through through a digital patient engagement platform, co-pays being collected, outstanding balances being collected, either pre-service or at the point of service. We're now seeing our clients begin to take the estimate and begin to ask the patient to say, oh, Guido, you're coming in for this, this eye exam, or you're coming in for this surgery, eye surgery. We estimate you owe $800. We're going to collect 50% of it now during the pre-check process. And then you're going to put a card on file so we're seeing that the payment of, not providing the service and billing. We're beginning to see practices beginning to get commitment for payment prior to delivering the service. And I think that is a huge change and needed change in the healthcare industry.
I agree. But I was really hoping you were going to say that you're developing the product to have a retina scanner so that you can walk in and put your eye in front of the kiosk and check in. Last question I have for you, so if a physician or a practice administrator, they're listening to this podcast and they've either taken the plunge and they're not happy, or they haven't taken the plunge yet, what's some of the ways that they can get tools to help them, or what would you advise them to do next?
I think number one, reach out to their peers. There's a lot of other groups that have tried, multiple or are using a digital, a patient engagement platform. So reach out to their peers. What I wouldn't do is just do a search on patient engagement software, because most of the time, the top 10, it's pay to play. So you're going to see names up there. You'll see EMR vendors up there. I would also suggest whatever EMR you're on, go to their website. Most of them, have partners, marketplaces, AP, that they have listings of companies that they work with, and many times they categorize it by clearinghouse, patient engagement. Look at the ones that actually are integrated to your PM system, because you could find the best patient engagement platform in the market, but if it doesn't integrate to your EMR, then it doesn't have any value to you. So those would be the two places that I would go. Is I'd first just go through your network of peers, and then number two, look at the EMR vendors and see what partners they have. A lot of EMR vendors will talk about patient engagement as a solution, but if what we see, a company that's just focused on that one piece does it better than a kind of a generic watered down version of patient engagement that an EMR vendor may have as part of their package.
Yeah, that's a great point. Something that I forgot to bring up is integration. There's a lot of vendors who say they integrate, but that's really not, bringing over the patient name, that's great, but it needs to do a lot more than that. So I think integration and looking at their tools, talking to their peers, those are great suggestions. So appreciate it. Well, Brian, I just want to thank you so much for joining us today, talking about the patient engagement trends. We appreciate it very much. Thank you.
I appreciate it. Take care. Have a great day.
I also want to take a moment to thank our listeners. We appreciate each and every one of you. We cannot do what we do without you. If you like our podcast, kindly share it with one of your friends on social media. Also, please don't forget to write a review on iTunes or Google Play. Your reviews will help other doctors and practice owners find us. Till we meet again, wishing all of you an amazing week ahead.